my channel. My name is Nakomle. Thank you so much for coming back once again, and for the new ones, welcome. Thank you. I really appreciate all of you. Okay, so today's video is about nursing areas or nursing specialties that you can move to if you're newly qualified, or you are someone that's been working for some time as a nurse and you just want to move away from the bedside. These are some other options that you can get into and still be a nurse, but not by the bedside. So if this is something that interests you or something that you're looking into, then stay right there. Do not move. Okay, so today I've got 10 different options that you can choose from, and this is by no means an exhaustive list. Okay, there are so many other options out there as well that you can choose from, but today I'm going to be giving you 10. Okay, so number one, we're going to be starting from theaters. Why not? Because that's where I am. So let's start from there. Okay, number one is the anesthetic nurse. So the anesthetic nurses, they work alongside the anesthetists inside of theaters to support them in giving anesthesia to patients that are going to undergo surgery. Okay, the first thing they do is they check the anesthetic machines, make sure it's all in working order. They prepare anesthetic medication for the anesthetist. They work alongside the anesthetist to deliver anesthesia. Mind you, they do not give anesthesia. Okay, they support the anesthetist inside of surgery to give the anesthesia. So they take care of preparing the anesthetic drugs, and then during the operations, if they need top-ups, they go and prepare that as well. Make sure that everything is nicely labeled and ready to be used when the anesthetist needs it to be done. All right, they also need to make sure that the relevant airway devices are also present for the anesthetist to use. So the relevant sizes, a few of those should be ready before surgery starts. Okay, now just going back, we need to differentiate between anesthetic nurses and nurse anesthetists. In the UK, we have anesthetic nurses where they support the anesthetist in delivering anesthesia. However, there are nurse anesthetists who give anesthetics autonomously. Okay, we don't have these inside of the UK. I understand in the US and other countries, yes, there is that role, but right now, currently in the UK, we do not have nurse anesthetists. However, we do have anesthetic associates. They are the only medical practitioners that are permitted to deliver anesthetics under supervision from the consultant anesthetist in surgery. So these are the two that we have here in the UK. An anesthetic nurse who supports the anesthetist in surgery. They do not give anesthesia, they support. Whereas there is the anesthetic associate who also is able to give anesthetics under supervision from the consultant, whereas nurse anesthetists are not in the picture at all here in the UK. Just bear that in mind. All right, moving on, number two, we've got the scrub practitioners. So the scrub practitioners, they are the nurses that support the surgeons during surgery. So they are responsible for making sure that all sets that are needed for surgery are ready and sterile, and that the right equipment are also present for the surgery. Now, whilst their scrub and surgery is ongoing, the scrub practitioners' duty or role is to support the surgeons by passing the required instrument for the particular surgery that is that is happening or that is going on. So most of the time you have to be really quick and really fast, and you would even need to know what instrument the surgeon needs before they even ask you for it, and that comes with a lot of experience. So that's also another great thing. So they don't necessarily have to deal with a patient directly, except of course if patient needs to be catheterized or anything like that, then they can do that, but most of the time they don't really do anything pertaining to patient care at all. All right, so that's the scrub nurse for you. So number three is the PACU practitioner or PACU nurse, which is the post anesthetic care unit nurse. Some people also refer to it as recovery nurse. Okay, And what we do is, I'll say, we are some of the first people that you see when you wake up from anesthesia. And what we are concerned about, or what our role is about, is a management of airway. So we do not want any airway compromises. We need to make sure that that airway is patent and everything is good with the airway whilst you're waking up from the anesthetics. Now, after you're awake, we're in charge of managing your pain, any post-operative pain. So we give really strong opioids or really strong pain reliefs that you would usually not have on the wards, but we are the only ones allowed and trained to administer such pain relief. Okay, at the same time, we also need to manage a patient's post-operative nausea and vomiting, because some of the side effects of anesthetics can be nausea, can be vomiting. So we have medications as well. We take care of giving and administering all those medications that combat any nausea and vomiting. Not only that, if a patient's had, let's say, spinal anesthesia, or they've had a limb surgery or something similar to that, we're also on top of neurovascular ops, making sure that that particular limb is starting to function as it was before the patient came in. Okay, because we don't want any compromises as well on that aspect. If a patient also has, let's say, local anesthetic pain relief like oncupalms and the rest, we are in charge of making sure that this patient is not suffering from any local anesthetic toxicity. We need to be on all of these before the patient is ready to be discharged home or to be discharged to the ward or wherever it is that they're going. And if there's any issues, we are the people to also escalate it accordingly. Okay, so these are just a few of the things that like recovery nurses or PACU nurses do. Now moving on to number 4, another option is the pre-assessment. So maybe this should have even started, because these nurses, they assess you before you go in to have your procedure. So they are the ones that are going to take down all of your health history, any illnesses that you have, any chronic illnesses, any conditions, any allergies, anything that might be a hindrance to you going to have your surgery. They are the people that take all of that information, and then they then send it to these anesthetists who go through it as well, and then they can deem you fit enough to go into surgery. So these people, sometimes you don't even need to go into hospital for them to assess you. They can even do it over the phone. So if you're such a nurse, you're away from the bed and you're not even dealing face to face with a patient. Okay, so that's another one in the bag. Ka-ching! All right, moving on. Number 5 is the PIP assessor, or the disability assessor. PIP stands for personal independent payment. Okay, so these nurses or medical professionals, because mind you, this role can be taken up by other medical professionals or other allied health professionals, such as like speech and language therapists or physiotherapists, amongst others. Okay, so these professionals, they thoroughly assess personal situations of people with disabilities to see if they qualify for the PIP, as I mentioned earlier on. So they ensure that those requiring these help and assistance from the government are able to receive it, and then they play a very key role as well in the health system. Okay, so say if a patient has a chronic illness or they have a certain disability and they need some kind of financial help to support them with their day-to-day living, this is where we come in, or this is where the health professionals come in, and then they do a thorough assessment. Based on their clinical judgment, they then send a report to the DWP, the Department for Works and Pensions, to now give these people whatever support financially, or if it's equipment or what have you, then this will be approved for them. Okay, so that's a great one as well. You don't need to be by the bedside, and you don't even need to be face to face with the people. You can do a telephone interview or telephone assessment, or even video assessments. Okay, so this is a great one as well if you're tired of the bedside, or you just don't want to go into bedside nursing. Mind you, before you are able to qualify for this role, you should have practiced as an adult nurse, okay, or in the other allied health personnel. You must have also been qualified for at least a year before you can be even eligible to take up that role. Okay, so that's that for you. All right, number 6 is GP nursing. Okay, GP nurses, they work in GP surgery, so they form part of the I would say primary healthcare team. So this includes doctors, pharmacists, and dietitians, amongst others. Okay, and in a large surgery, you could be part of like a team of nurses who share duties and responsibilities. But in other GP surgeries that are quite smaller, you might be working on your own and taking on so many roles. And what do these GP nurses do? Usually they'll be doing things like obtaining blood samples for patients. They will be doing ECGs, they do minor and complex wound management as well, including leg ulcers. They do travel health advice and vaccinations, child immunizations and advice, family planning, women's health, including cervical smears. Have you done yours? And then men's health screening, sexual health services, smoking cessation screening, and helping patients to manage long-term illnesses like, you know, COPD, emphysema, all of those, diabetes, what have you. They do all of these, and these are also patient-facing roles, but they are not necessarily bedside roles. You are not in the ward. You can be in an office or in a clinical environment as well, but not in a bedside nursing role. Okay, so that's another great one as well that you can think about. All right, number 7 is nurse researchers or research nursing, or in other words, clinical research nurse. Okay, and they play a vital role in delivering clinical research and ultimately improving patient care. All right, so what do? They support patients through treatment as part of a clinical trial. At the same time, they prepare trial protocols and other related trial-related documentation. They also help to develop new drugs and treatments, care pathways or regimens for patients. They deal with data collection. They submit study proposals for regulatory approval. At the same time, they coordinate the initiation, management, and then the completion of the research. And then they also manage teams. All right, and this is the only evidence-based method of deciding whether a new approach to treatment or care is better than the current standard. And this is also like really essential in diagnosing or treating or preventing or even curing diseases. All right, so this is another great role for a nurse. If you're tired of the bedside, you can go into research nursing, and it's also a very good niche area. All right, moving on, number 8 is specialist nursing. Okay, so let's say you're a nurse and you have a particular interest, or you're passionate about a particular area of nursing. Let's say an example is diabetes. So you're passionate about diabetes, or you're passionate about COPD management, or you're passionate about pain management. This is a great avenue or a great option for you to just specialize in that one area, and then you help patients with those usually chronic conditions to manage their condition. And with this one as well, even though it's patient facing, it's not necessarily a bedside nursing. Okay, so this can also be in the community or in the acute setting, or even both. All right, so that's another great option for you if you're tired of the bedside. All right, number 9, occupational health nurses, or OccuHealth nurses as some people call them. And we know these are the nurses that protect and promote health of people at work. So all employees, if you have any health related questions and problems, these are the people that you go and see. All right, they make sure that they protect employees in their workplace from accidents or any injuries or any exposure to harmful substances whilst they're at work. All right, these are the people that you go to. Not only that, but their role entails so much more. So things such as like education and training, counseling and support, risk assessment and risk management, travel health, and providing health screening services, giving vaccinations, taking blood samples, health surveillance, so much more. Okay, so they are also not bedside nurses. All right, so if this is something that interests you as well, that's for you to go and look for. All right. So finally, number 10, drum roll, is lecturing or teaching. So this can be divided into two as well. So you could be teaching either the theory aspect of the course in university, or you can be the clinical skills lecturer or tutor, teaching the practical aspects through simulations before the students go on to placements to do the actual practice placements. Okay, so these are the 10 that I have for you today, and like I said from earlier on, there are so many others out there that you can choose from if you're tired of the bedside, or you just want a change of environment, or you just want to take on more challenges, or you just want to do something different but still be in the nursing profession. Okay, so if this was something that you really enjoyed, please give me a thumbs up and just subscribe. Turn on your notification bell so that every time I upload a video, you will know right away. So for now, it's bye, take care and be safe.